Motor unit. Motor unit is the functional unit of muscle contraction in intact body. It consists of single motor neuron cell body, its axon fibers and muscle fibers innervated by it. The cell bodies of the motor neurons supplying the skeletal muscle fibers lie in the ventral horn of the spinal cord or the motor cranial nuclei. In simple words, each single motor neuron and all the muscle fibers it supplies constitutes motor unit. So this is the diagram showing the motor unit. Motor unit is nothing but it is the number of muscle fibers which are supplied by single spinal motor nerve. Properties of motor unit. The number of muscle fibers in a motor unit varies inversely with the precision of movements performed by that part. Each motor unit innervates only one type of muscle fibers. In other words, in a single motor unit, the muscle fibers supplied by it are of same type. There are two types, that is red type, that is also called as type 1, and white muscle fibers that are also called as type 2 muscle fibers. All the efferent fibers passing to skeletal muscles are excitatory. There are no efferent nerves which on stimulation produce relaxation of the muscle. That is, there are no inhibitory efferents to skeletal muscles as compared to cardiac and smooth muscles, where efferent supply is both excitatory and inhibitory. Depending on the type of muscle fibers they innervate, motor units are of two types, slow and fast motor units. Coming to the applied aspects, when motor nerve to a skeletal muscle is cut, it causes diffuse atrophy of the muscle. That is, it causes shrinkage of the muscle fibers, which finally gets replaced by fibrous tissue. Or there can be complete paralysis of the muscle. And there can be appearance of fine irregular contraction of individual fibers called fibrillation. There can also be a de-innervation hypersensitivity. These effects are the classical consequences of lower motor neuron lesion. That is the injury to the spinal or cranial motor neurons which directly innervate the muscles.